Hi, it's Karen again. I'm sorry, the last video kind of got cut off, and because my SD card was full. So I just want to continue, and I want to go a little bit faster because I seem like I'm just yapping a lot. I hope I'm answering some of your questions. I was talking about how the spinal cord stimulator was working for me, and I want to say that it's about at 50%. I would say about 50% less pain. Most days before, I couldn't even get out of my chair. And my level was maybe at an 8, sometimes 9. Now I am doing more, I'm walking more, I'm standing more, and the pain is down to maybe like a 6, 7. Of course, some days you have more pain and some days less. But absolutely worth it, absolutely working. A couple other things I wanted to go with. Just about using the stimulator. I have the Boston Scientific stimulator and the paddle. This is the remote control, and you just press this button on the side and it starts. And then your representative will come in and he will make different programs for you. You could, ask him to tweak it. They're very good. They will answer any questions. They will come and meet you anywhere and help you out. So don't hesitate to call them with any questions that you have or any concerns. You could have, there's 2 different types of programs. You could have stimulation that you feel like with a TENS unit. You can make it really strong, you can make it light. You could have ones that just are on your legs or just on your back or wherever your pain happens to be. They will direct it to that specific area. And then you have stimulation programs that you don't feel, which I usually use most of the time. I don't want to constantly feel the stimulation. Sometimes you really do, but sometimes, especially if I'm sleeping, I put it on low and I put it where I don't feel it, and it's still working. It's really an amazing thing. After the surgery, I said the first couple of weeks were really rough. Really, it did take me those full 6 to 8 weeks to get back on my feet, and but hang in there. It will get better. It will, like I said, now I don't even know it's there. I maybe like 95%, you don't even feel it anymore. Every once in a while you do feel it, but it's really not bad at all. What else did I want to tell you? Also, after the surgery, you don't want to bend, you don't want to twist, you don't want to stretch, and for some reason, when you have the spinal cord stimulator and you lift your arms up, if you have the stimulation on, it makes it stronger. Or if you arch your back, it makes it stronger. I guess it's just the way it hits on your spinal cord. So just know that sometimes you'll do that. You'll be like, oh, what's that? And that's all it is. It's your movement. That's why at the beginning they really want you to be careful. Also, one thing is, if you drive, just make sure when you're driving you shut off the stimulator. For some reason I forget all the time, but just in case, because if you get a twitch or something, I've never experienced that, and you're driving, not a good idea. So do shut it off when you're driving. You can have it on while you're sleeping, any other time. And the only thing that you can't do once you have the stimulator is you can't have an MRI unless you get a specific one made for that. I know they do have one that's made so you can get MRIs, but most of the time you can't get an MRI, basically because it's made of metal and you can't have any metal in an MRI machine. So otherwise, I don't think there's any other limitations. I asked my representative about, like, say, going through a metal detector, different things like that, and nothing else seems to be a problem, just the MRI. I told you about if you're constipated after the surgery, don't wait too long, talk to your doctor and get something for that. Also, after you have the surgery, please get one of those grabbers, one of these things. You go like this and it'll grab. That's really for anyone having any kind of surgery, because the minute you can't bend, you drop everything on the floor. So they're very handy to have if you are having the surgery. Again, any questions you may have, anything that maybe I didn't answer in these videos, because this will probably be the last video. You could reach me. The link is down below. You could, write the comment right under this, or I give you my address to go to Facebook. You could go find me there. Ask me any questions you have about the spinal cord stimulator. So, and also the videos I have before, I took you all through before the trial, during the trial, and during the actual permanent spinal cord stimulator surgery. If you're having it, good luck to you. I wish you all the best, and that's it. So if you need me, I'll be right here. Bye now.